You chose Practice Fusion because the clinical side works. It is clean, cloud-based, and built exactly for independent practices. But somewhere between the patient encounter and the paid claim, your revenue is quietly leaking out of the system. The clinical technology is sound, but the revenue disappears in the workflow gap, the specific space between the doctor's note and the clearinghouse submission. If you are relying on a billing team that had to learn your setup from scratch, you have likely been losing money since month 1. Look at this chart showing the national trend for initial claim denial rates. According to recent data from Kodiak Solutions, that number climbed to nearly 12% in 2024. Payers use these initial denials strategically to delay payments. If your practice submits 500 claims a month, a 12% denial rate means 60 of them come back rejected on the first pass, demanding immediate rework. Compare that 12% to industry targets. Best-in-class practices aim for a denial rate below 5%. High-performing teams consistently hit 2 to 3%. If your number sits above 10%, shuffling your current staff will not fix the issue. You have a structural billing problem. Practice Fusion supports 30,000 practices and 5 million patient visits a month. It succeeds by stripping away the IT complexity found in enterprise systems. But that same focus on clinical simplicity means the billing engine relies on manual configurations and specific clearinghouse setups that generalist billers rarely see. A biller who knows Epic or Athena is not automatically competent here. The superbill flow, the clearinghouse connections, and the way encounter data maps to CPT codes all have Practice Fusion-specific configurations. This timeline charts the typical productivity of a new in-house biller. When you hire someone who doesn't know the specific platform, it takes them 60 to 90 days of training just to become fully productive. During that 3-month window, your billing queue is delayed, claims are under-reviewed, and because the biller doesn't know the exact configurations, preventable rejections pile up. The first 2 to 3 months of a new hire is a paid training period with zero output guarantee. Your cash flow absorbs the risk. That training period becomes a continuous loop because of the current staffing environment. Medical practices are dealing with a 40% annual turnover rate for front office support and over 33% for business operations staff. This graphic breaks down the true cost of replacing just one frontline biller. Factoring in recruiting, onboarding, and lost productivity, a departure costs between $25,000 and $30,000. Look at the annual baseline. A fully loaded in-house biller, including salary, benefits, and taxes, runs between $55,000 and $75,000 a year. Medical groups reported an 11.1% increase in total operating costs in early 2025. Labor was the primary driver pushing those expenses upward. The comfort of having a biller sitting down the hall is expensive. It actively erodes your margins and ties your revenue cycle to a single point of failure. Look at this mechanical sorting process. This is exactly how the clearinghouse problem works in Practice Fusion. The EMR has specific integration and rejection patterns. If your biller doesn't recognize those specific errors, identical claims repeatedly fail and pile up in the rejection queue. Then there is the coverage gap. The moment a solo generalist biller takes a vacation or quits, accounts receivable ages. Timely filing deadlines are missed. Denials that could have been easily appealed go untouched. When a workflow breaks, a generalist biller has to escalate the issue because they lack deep EMR-specific knowledge. Escalation burns time and collections halt. Add coding errors to that equation. Payer audits have doubled and coding-related denials have spiked 126% over the last 3 years. Shuffling your staff will not solve these bottlenecks. Practice Fusion requires a team that speaks its technical language from the exact moment they log in. High-performing practices using cloud-based EMRs approach this differently. They prioritize EMR-native billing expertise immediately. They completely skip the generalist training phase. Clean claim rates are monitored in real time. The industry average hovers in this red zone, between 85% and 90%. Every point below optimal means compounding rework. The HFMA benchmark pushes that needle to 95%. Top-performing practices reliably hit 98%. They achieve this through specialization. By outsourcing to a team that works exclusively inside Practice Fusion, the claim rules are configured perfectly to match payer requirements on day 1. 2 months of a new hire's learning curve costs your practice roughly $12,500 in salary for half productivity. Outsourcing to an EMR-certified team stops that waste immediately. Staffingly provides AAPC and AIMA credential billing specialists who already operate inside Practice Fusion workflows every day. This chart shows the financial impact. The fully loaded cost of an in-house employee is $55,000 to $75,000. Staffingly drops your baseline to $399 per week, a direct labor cost reduction of more than 50%, eliminating turnover risk. Staffingly also integrates AI-augmented tools into the process. Smart routing directs claims based on payer rules, and automated daily audits flag error patterns before they result in a denial. Practice leaders are making a strategic choice here, prioritizing the math of a predictable external team over the instability of in-house staffing. The transition is fast. EMR access is established within 24 to 48 hours. The team completes your specific protocol training and is live, actively working your billing queue in just 14 days. Your data is protected by enterprise-grade security. The compliance stack includes HIPAA, SOC 2 Type 2, ISO 27001, and HITRUST. There are no long-term contracts. The arrangement runs strictly month to month, starting with a 14-day risk-free pilot. If you are an independent practice owner, tired of watching accounts receivable age, while a generalist biller spends months trying to figure out your software, the solution is already built. Visit staffingly.com/demo or call 800-489-5877 to book a 30-minute strategy call. Look at the exact billing potential for your specific practice. Stop paying for a 90-day learning curve. Start capturing the revenue you have already